The impact of effective leaders, impacting healthcare. By the end of this presentation, you will be able to describe ways effective leaders impact healthcare. You do not need to have a specific job to be a leader in healthcare. Leaders are those who seek changes to improve the treatment and care that patients receive. Effective leaders ultimately empower those that they are leading. They set the example, create a culture of excellence within their team, maintain a positive attitude, and ensure a big picture direction for an organization or team. Effective leaders provide educational and training opportunities to their team so that they continuously provide the best and most effective care for patients. They also create a culture that encourages team members to develop their skills through education, training, and personal development so that they can thrive in their career. Throughout history, many people have sought new approaches to medical care. A few names stand out as leaders that made effective and lasting impacts in health history. They each played a role that forever impacted the health care that we receive and give to patients today. In 1832, Dr. James Smith, son of freed slaves from New York City, began his studies, which led to 3 degrees, including a doctorate in medicine from the Glasgow University in Scotland. In 1837, he returned to New York City as the first degree-holding African-American physician. He opened a medical practice and pharmacy that was integrated to take care of all human beings, no matter their ethnicity. Dr. Ignaz Semmelweis was a Hungarian doctor in the 1850s that cared for pregnant women. At the time, many women died of infection after childbirth. An uncommon practice at the time, he ordered his medical students to wash their hands in a solution before caring for laboring women. Although it would take many years and many physicians after him before hand washing would become a norm in the field, his impact will forever change healthcare. Clara Barton is most famously known for her incorporation of natural disaster relief into the vision of the American Red Cross. But she began the organization by delivering medical supplies, food, and giving medical care to soldiers during the Civil War. She begged and fought to be able to take supplies to the front lines and be sure to care for those serving, where she earned her nickname, the Angel of the Battlefield. Dr. Sigmund Freud drastically impacted the study of the mind. The study of the brain, the psyche, and mental illness will forever be impacted by Dr. Freud. He is one of the most influential intellectual legislators of his age. His theory of psychoanalysis not only seeks to explain human behavior, but is also a modern method for treating mental illness. Mabel Staupers, a nursing school graduate from Harlem, fought for the integration of Black nurses into the armed forces. In 1941, the U.S. Army Nurse Corps began admitting Black nurses, and in 1945, the Army and Navy wholly accepted Black nurses. She was a leader in racial integration in healthcare and forever changed the rights of those working in the field. After attending medical school, Dr. Joycelyn Elders began her studies in pediatric endocrinology and was later nominated by President-elect Bill Clinton to be the first African-American U.S. Surgeon General. Not only was her role historic, but she also did work that impacted the public health and medical communities from a federal and national level. Her work paved the way for many Black medical doctors after her to lead our nation in public health care from the federal government. Healthcare and medicine today has been affected by the discovery of genetic sequencing. The Human Genome Project was an international collaboration of researchers that lasted from 1990 until 2003. This collaboration successfully identified and mapped all of the genes of the human genome. The Human Genome Project was revolutionary and highly successful, thanks in part to the effective leadership of Dr. Francis Collins. The Human Genome Project's work impacts healthcare today and will continue to play a major role in disease management and medication therapy. These are just a few examples of the incredible progress that medicine and healthcare has made due to leaders who are willing to notice the details, go against the grain, make changes in their practice, and inspire others to do the same. Remember, anybody can be a leader. What difference will you